Millie will start the recording. Millie, are we there? And we're off.
Thank you, David. Good afternoon, everyone, and welcome to this Decision Day. I'm Councillor Liz Fairhurst, and I'm the Executive Member for Adult Services and Public Health. And this first item is with the Public Health team, and we have the Director of Public Health, Simon, with us, and Mohammed, and they're going to talk to us about the Smoke-Free Hampshire. The sooner the better. So over to you, Simon.
Many thanks, Councillor Fairhurst. I'll give a short introduction and then hand over to Mohammed. So this paper is setting out our approval to spend for some money, which includes both money from the Public Health Ring Fence grant and also some new funding around a smoke-free generation. Colleagues, be aware that back in the I think the autumn or late summer, the Prime Minister announced a number of measures, and part of it is about increasing spending on local smoking cessation services. And just to add, before Mohammed comes in, this partners a paper going to Cabinet in April, where the proposal is that the County Council signs up to the Smoke-Free Pledge. Mohammed, over to you.
Thank you, Simon. So the request is for up to £23 million over 7 years to procure a community stop smoking service. And this is a real opportunity to extend our leadership in Hampshire around preventing ill health through smoking cessation. Sorry, I've got to get those words out in the right order. There's still, 10% of the Hampshire population continues to smoke, and that figure is higher in some demographic and population groups than others. For example, in routine and manual workers and in those with mental ill health. So this is a real opportunity to really embed smoking cessation in our target community groups and drive down the rates of smoking so that we can reach our 2030 targets to be smoke-free and have a prevalence of less than 5%. Smoking still costs Hampshire County Council and the economy at large a tremendous amount of money through sickness, absence from work, through admissions to hospital, and through early death. And so we really see this as an opportunity, our number one priority, if you like, from a public health perspective, to protect and prevent ill health in the population. Thank you.
Thank you, Mohammed. I was speaking to Simon earlier about this, and we were talking about the follow-up for people who might need a little bit more help. And Simon, you were going to look into, you check on them after 12 weeks of doing a programme. That's correct, isn't it? But we might need more. Sorry.
And Councillor Fairhurst, you're absolutely right. There's something about if we support people in a very evidence-based structured programme, follow up at 4 weeks and 12 weeks, and with the increased money, we want to focus on those more vulnerable populations who actually may need a different level of support for perhaps a bit longer. So this increased funding enables us to trial different things to see what works to support clients. Maybe that's adult services clients with serious mental illness, or those in different settings. For example, we've trialled a programme in our drug services, so those people who are co-occurring illegal drugs or alcohol and smoking. So a number of programmes we're trying through this increased funding.
That's brilliant, I think. Councillor Withers, do you have any questions?
No, I don't, Chair. I think this is a very important subject. We obviously made great measures during COVID, and particularly with maternity services, with pregnant ladies reducing smoking by 50%, and then the other 50% going on to vapes as a measured step to reducing smoking. So I think, although 23 million seems a lot of money over 7 years, the cost of the NHS, public health and social care far outweighs that amount of money. So anything we can do to challenge the cessation of smoking from 10% down is very important. So I fully endorse it.
Thank you. Councillor Warwick.
Yes, thank you so much, Councillor Fairhurst. Mohammed, I read through the paper and I note younger people are now moving towards vaping and e-cigarettes. Can some of the money be directed towards perhaps even reducing? I know we're not too sure of the impact of vaping, and it's not as bad as smoking, of course, but can some of the money be used to prevent vaping as well?
Yeah, absolutely. I think paragraph 16 touches on that precise point. We do see it as a rising concern, particularly among those who have never smoked cigarettes and among younger populations. And this does provide an opportunity to be innovative. We already have a pilot vaping cessation service that we're currently rolling, and we're not aware of many other parts of the country that do something similar. So we consider ourselves kind of leaders in that space, and with the impending disposable or single-use vape ban, we expect demand for vape cessation will go up, and so we are kind of clearly factoring that in with this new procurement as well.
Brilliant. Thank you so much.
Thank you. Councillor Briggs.
Thank you, Councillor Fairhurst. Fully endorse it. It is an awful lot of money, but having grown up in a society that everyone smoked, parents, grandparents, I think we're making amazing progress, and if we can have zero smoking in a few years' time, that's to the benefit of all. But I agree with Councillor Warwick. It worries me about the young people around our schools where you see them all smoking. So I do think a lot of the resources, as Mohammed has said, needs to be put to our schools. Thank you.
If I could respond to that, because I'm well aware that we have sent out information on the dangers of vaping to all our schools as part of the anti-vaping task group that Public Health and Trading Standards are leading, or all schools, and that was information sent to parents as well, I believe, from the schools. So I do feel we're probably on top of that at the moment. Simon, sorry.
Yeah, Councillor Briggs, you're right. It's a really important issue. We sent some information out to all parents via schools, and through a couple of kind of heads and assistants heads, they said it was incredibly helpful. They hadn't had anything like this, but also it's how we help parents and teachers talk about these issues. Brilliant educators, I'm not criticising teachers, but they're not used to talking about health issues in the same way. So we're really helping that conversation. So I think that will carry on in our work going forward, working with our education colleagues to really, as you say, turn that kind of tide around, which we've seen previously, to become a smoke-free generation.
Okay. Anything else? If not, I'm more than happy to approve this. And Mohammed, I wish you all the success in the world to achieve this. I'm not sure we'll ever get down to ground zero in terms of smoking, but oh, sorry, Bill, you wanted to say something?
I just wanted to ask the question. I mean, Simon or Mohammed said this is ring-fenced funding, and I think actually we need to do a bit more PR on that, because for the public to understand, this 23 million is ring fenced and cannot be used in another area, and I think that's a very important message we want to get out. Smoking, reduction of smoking is so important that this is ring fenced.
Shall I, Councillor Fairhurst, can I just respond on that?
You can come out, yeah.
So Councillor Withers, you're absolutely right. Firstly, the public health grant is ring fenced for prevention of ill health, because if we don't ring fence the prevention grant, it's much, it's really important that we focus on that, because it's otherwise no one else does it. This extra money that we're given is predicated on we spend the same amount of our public health grant and add to it. So it's kind of got a double ring fence. But Jane, in terms of the comms, I think we can be clear it's part of the ring fence grant. And I think we need to say, with Councillor Warwick as chair of the Health and Wellbeing Board, when we go back, we're doing our bit, other partners step up and support us.
Happy, Councillor Withers? I've seen Jane nodding away. She. Oh, look, she's gonna. Are you going to say
Thank
something?
you.
Jane?
So yes, Councillor Fairhurst, as you know, we're planning, obviously, once your decision is made, to put some communications out, and it does make it clear that this is a ring-fenced grant and that the money obviously cannot be used for other purposes over and above preventing ill health.
Yeah. Thank you.
And
for
we'll
that,
continue
Jane.
with that message as well. Thank you.
Yeah, absolutely. Okay, then I'm very happy to, as I say, approve this. Mohammed, good luck. Look forward to us being ground zero at smoking. We'll see what happens. Thank you.
Thank you, Councillor
Thank you very
Fairhurst.
much.
Thank you. Right, I'm going to now pass on to Councillor Warwick for her role in this decision day. So, Councillor Warwick, over to you.
Thank you so much, Councillor Fairhurst, and welcome to the continued D-Day. I'm Councillor Jan Warwick, and I'm Executive Member for Younger Adults and Health and Wellbeing. And I have one paper on the agenda today, which is the annual core infrastructure grants to voluntary and community sector organisations. And Peter, I think you're going to present this paper for us this afternoon.
Yes, I am. Thank you, Councillor
you.
Warwick. So the paper is in respect and is seeking a recommendation for the approval of two grants as which are infrastructure as part of our infrastructure grants programme. They are one is for 350,000 to Community First Wessex, which is to support the infrastructure and the Hampshire Council of Voluntary Services network, and the other is a grant seeking to fund a grant of 63,000 to Systems Advice Hampshire for 24-25 to support the wider Systems Advice network within Hampshire. So the infrastructure grants are there to concerned with, but not limited to, identifying the needs and facilitating improvement in service provision across the voluntary and community sector, assisting local organisations to function more effectively, and enabling effective communication between ourselves as the county council, as well as local groups and communities and the wider voluntary and community sector. And also, lastly, supporting organisations to influence policies and plans that have an impact on their organisations and beneficiaries. In respect of the Hampshire Council of Voluntary Services, or CVS network, this network comprises of 8 organisations which cover the whole of the county area on which the county council operates. This currently is funded. This funding goes to Community First Wessex, and we're looking to fund them again for that following year, who act as a single grant funded organisation to oversee the infrastructure grant and the associated requirements, distributing funds as required to those other organisations to enable that work to take place. But other grant, the 63,000 System Advice Hampshire, that we retain this long-standing relationship with that organisation to deliver training and development to both the paid employees and volunteers across the 12 local Citizens Advice offices, as well as it also helps coordinate and fund their revenue services, which help provide specialist advice lines on employment welfare, and maintains a single point of contact between the local Citizens Advice and wider strategic partners, including the county council. In terms of the finance of this report, the grant proposals will commit an additional expenditure of 413,000 over the financial year of 2024 to 2025. In recognition of the financial context in which the county council is operating, and this actually is a reduction of £149,990, which is a 26% reduction on the grant award we made for the current year of 2023 to 2024. This saving has come from the CVS network element, which, although may affect their ability to develop new initiatives, it will ensure and maintain existing support for the voluntary and community sector over the coming year. In terms of performance, these are large grants, but we have worked with both these partners for a number of years and actually awarded these grants to these partners both in the current year and in previous years. and we have a good working relationship with them. We have quarterly meetings with them, as well as monitoring reports which look at the benefits they give to the county council and its residents, which it serves, such as the amount of volunteers it helps them source, as well as the amount of funding it helps generate from external sources, which then go into that wider voluntary community sector, and also assist us by helping prevent an escalation of needs for social care services, both in adult services, but also in children's services and in other parts of the county council's work. In terms of the grant, as part of the grant agreement, they will sign a declaration stating that they accept the grant funding is only awarded for the given period of the grant, and that no commitment exists to fund continuous funding after this time or in any future subsequent years. So there's the proposals that are recommending funding before you today.
Brilliant. Thank you so much, Peter. I know most people would be very familiar around the work of what the Citizens Advice Bureau does. Are you able to give a hint of the sort of organisations that Community First Wessex will be sort of supporting on our behalf, if you like? So does it reach across the whole county, and are we talking of lots of different types of community support?
So what we fund the CVS network for, so Community First Wessex are the lead organisation for those 8 bodies, which include others but the others are Unity, Rushmore Voluntary Action, Gosport Voluntary Action, Heart Voluntary Services, Basingstoke Voluntary Action, and One Community in Eastleigh. As those sort of providers, they help support the wider voluntary, as well as delivering services themselves, they support the wider voluntary and community sector organisations. So organisations can become members of them, and they have many members, which then, in doing so, what they also then link them through is to volunteering. They run the volunteering bureaus, which often people use to access that. They not only do they have those in-person bureaus, but they've moved now more to is a digital model where there's a Get Volunteering website, which also we utilise ourselves to help find volunteers for county council delivered services and projects. But also they provide training in terms of safeguarding training and other training, as well as trustee training. And the other element is support of that wider sector in terms of voluntary development, in terms of helping working with partners, including ourselves, the University of Winchester, to make sure we've got a clear volunteering base. And last but not least, fundraising. So helping organisations source and find funding, as well as coming together to kind of provide that systemic approach. So when organisations helping form partnerships to deliver services across organisations, so kind of forming that brief.
Brilliant.
So that's part of the work they do.
Yeah, no, thank you, Peter. I just wanted to sort of explain the breadth of this grant, because in isolation it doesn't seem very much, but it's a relatively large sum of money. So it's the outreach is far and wide, isn't it? Councillor Fairhurst, do you have any questions? You'll be very familiar with this grant, I know.
Yes, I have no real questions. I think it's a shame we're having to look at doing things like this to reducing our grants, but I'm quite convinced that Peter and his team will be working really well with them to ensure that there's no drop off in their work. Thank you.
Brilliant, thank you. Councillor Withers.
I think I agree with Councillor Fairhurst. It is sad that we're having to reduce the amount of grants that we're giving. Already, I think most county councillors will have had letters from organisations, particularly in Rushmore, the voluntary service network there, asking for us to give as much support as we can, because the need isn't reducing. The need is getting greater, and the variety of, if you want, outputs are getting greater, and therefore I think on the one hand it's very sad that we've got to reduce the amount of grants we give, and as Peter said, it is stipulated for a certain period. But on the other hand, it has triggered other organisations to look at what they've been doing in recent years and to discuss with us ways of actually changing the way they operate. And I think a lot more organisations are talking to each other to see how they can cope with the future reductions and actually grow with local businesses as well. So I fully support the fact that we have to do this, but I also fully support our local organisations that are looking to other ways of trying to fulfil the need that the public has.
Brilliant, very well summarised. Councillor Briggs, do you have any comments or questions?
Really just a comment. Thank you, Councillor Warwick. I agree with what Councillor Withers has just said, but I just think we are so lucky to have so many people that volunteer for these organisations, and I'm sure with Peter's help a way will be found that we can keep them and help them to, when we reduce probably the grant again. So yeah, I think they both do sterling work for us. Thank you.
Thank you so much. Peter, you wanted to come back.
Yes, just to say, in terms of that point that both Councillor Briggs, Councillors Fairhurst and Withers made, in terms of that support, we are working with them in terms of, even over this current year, about how things can be done differently. So, and that's, and we're always looking at how we can look at alternative models and support them in that. In some ways, that's one of the reasons we during the time of COVID, well, that seems a long time ago, set up a volunteer hub to kind of look at ways, that strategies to maximise that volunteering. That's separate to the grant, but that continues to meet and is now, we've now moved that across to being led by the University of Winchester, who have got a specialism in that area. However, we're very much involved. And again, that's looking about what alternative funding we can bring in, maybe even from the higher education research sector, to help fund that further development, which can also inform further practice and do things in a more efficient way going forwards. So we're always looking to work with them to find those new efficiencies and alternative funding models to continue their much valued work.
Brilliant. Thank you so much, Peter, and thank you for your really thorough presentation of a very good paper. So I'm very happy to approve the recommendations laid out in item 2 on page 1 of the report. And that's the end of my D-Day. Thank you so much.
Right, well, thank you all very much. Oh, sorry. David, can we cease recording now?